Hello, my name is Tyler Curtis, and for my project I picked the physician assistant. The physician assistant is something that I've been interested in pursuing for a number of years. Physician assistants, in a primary care setting, often act with the same knowledge and scope of practice as a physician. Everything is done under the care of an overseeing MD. However, the physician assistant often serves as the patient's primary health clinician. The daily tasks of a PA are similar to that of a physician, up to a certain level. Physician assistants can see new patients, take patient history, collect vital signs, perform physical assessments, develop new care plans, prescribe tests and prescriptions, along with arranging any necessary follow-up information for the patient. PAs could have different duties based on what specialty they work in. An emergency room physician assistant could work in the triage area, assessing who comes back next, where a surgical PA could spend much more time talking to patient's family, possibly opening and closing during surgery. The physician assistant is not that old of a profession. In the 1960s, top doctors realized that the country had a shortage of primary care physicians. Dr. Steed, out of Duke University, helped remedy this problem with the creation of the physician assistant program. The limits of what PAs can and cannot do vary from state to state. This infographic to the right depicts how the scope of practice is divided throughout the U.S. Florida is included in the states where supervision is determined by the state's medical board. This board is the Florida Department of Health, which oversees all laws and licensing for Florida healthcare professionals. PAs almost seem like the glue that bonds the conglomerate healthcare team together. The physician assistant can speak to the family and handle the medical aspect of the case, and the PA can also communicate with the nursing staff to assess how the healthcare plan is coming along. In my experience, PAs have usually been more approachable than the physicians. This helps us work better as a team for communication and care, along with making the patient feel more at ease. There are a number of different work settings to choose from. Just about anything a physician can specialize in, a PA can too. Although primary care is often pushed out to PAs as the priority, because that is what the profession was made for. Some areas to specialize in include cardiology, dermatology, general surgery, orthopedics, sports medicine, and oncology. Although specializing is attractive to most PAs, staying in primary care should be a goal of the profession in the next 5 to 10 years. The number of patients in the healthcare system will skyrocket due to the aging of the baby boomers. Having hundreds of specialty referrals ready and rating won't help as much if the patients don't have primary care physicians ready. Fixing this before it becomes even more of an issue should be a priority of the profession. The requirements to become a physician assistant include obtaining a bachelor's degree, completing an accredited PA program, passing the PANCE, the licensing exam, and then continuing to earn CEUs throughout your career. PA school is highly competitive. It is similar to medical school, with the exception of PA school focusing on patient care experience, GPA, and test scores, rather than research, volunteering, GPA, and test scores. PA schools actually have a lower matriculation rate than MD or DO. Speaking of CEUs earlier, they are actually referred to as continuing medical education by the National Commission of the Certification of Physician Assistants. Over the course of 10 years, after taking your PANCE, you would be required to submit 100 Category 1 and Category 2 credits. Category 1 includes a long list of specified top-level training, including many national care standards. This is my 5-year timeline. It is comprised mostly of prereqs and PA school, starting this summer with graduating with my bachelor's degree, December 2020, completing my PA prereqs, January 21, take the GRE, with March 2021, applying to PA school. The next step is to finish my PA school prereqs, shadow, gain patient contact experience, take the GRE, and apply to PA school. According to PALife.com, North Carolina, New York, and Baltimore are some of the top cities to live in while working as a physician assistant. I would like to move somewhere north of Florida, so they top my list as well. As for specialties to look into, I'm not too sure yet because I don't know what the day-to-day life will truly be as a PA in those specialties until I do it myself in the clinical year of PA school. Right now, I'm leaning towards cardiology or emergency medicine, but I'm open to all options that could help me in my primary care practice eventually. In conclusion, physician assistants work under physicians providing total patient care. They interact with many members of the healthcare team to truly work what's best for the patient. I hope the physician assistant career serves me well as I serve my patients well in the future. Here are my references.